In this video, we will learn how to read an ECG. ECG electrocardiogram. Electrocardiogram is graphical presentation of graphical description of electrical activity of heart activity of heart by placing electrodes in an orderly fashion across the chest and on forelimbs. On ECG, voltage is presented on vertical axis and time is presented on horizontal axis. In this diagram you can see normal ECG. This is positive deflection P wave and negative deflection is a Q wave, and then again positive deflection R wave and negative deflection is S wave, and then there is a T wave. In this diagram, voltage is on vertical axis and time is on horizontal axis. In normal ECG, one small box is equal to 0.04 second, and one large box is equal to 0.2 second. And voltage, one small box is equal to 1 mm and one large box is equal to 5 mm. Standard ECG paper speed is 25 mm per second. Standard ECG paper speed is 25 mm second. There are 6 chest leads. There are 6 unipolar chest leads. Unipolar chest leads. V1, V2, V3, V4, V5, V5, V6. V1 is placed on 4th intercostal space and V2 is also on 4th intercostal space. The remaining portion we will discuss in another video. Thank you.